I think this is a very important study for a number of reasons. But again, to give it some framework, peripheral T-cell lymphoma is a more difficult tumor to treat in general. The ECHELON-2 looked at peripheral T-cell lymphoma with a significant proportion of patients, 70 to 75% of patients with anaplastic large cell lymphoma. The goal of treatment was the same, ideally to cure more patients with the experimental arm, but the comparison here was seen in slightly over 400 patients, again in many centers around the country and the globe, where they looked at CHOP, which is a standard T-cell regimen, compared to Adcetris CHP. And what they found was the benefit of CHIP, I will say, over CHOP was significant both in terms of progression-free survival and overall survival. And the median progression-free survival and overall survival were statistically improved in the CHIP arm over CHOP. And that was meaningful, not only at the initial presentation, but now at 5 years, it's obviously clinically very significant because this suggests that the cure rate for that arm is higher than CHOP alone. So that is, again, very meaningful. From a side effect profile, I think what was impressive was that unlike in the ECHELON-1 study, febrile neutropenia was not statistically different. And while there was, again, neuropathy, not unexpected, this too seemed to dissipate over time. And most patients had improvement or resolution, particularly at the 5-year mark, suggesting that this was a time-dependent phenomenon.